Hi everyone, you're listening to Let's Psyconnect. This is LT.
And this is Ronnie.
First, we actually want to invite you to go to our Instagram, Let's Psyconnect, all one word, lowercase, because you can also watch this episode. We actually have a guest speaker with us. Her name is Dr. Meier, and we're so happy to have her here to talk about forensic psychology. Ronnie and I were more passionate about health psychology, so this is like forensic psychology is very important to us, and I believe to some of our listeners as well. So we want to address some of the myths and some questions that we're dying to learn about. We want to learn more about this field so that we can maybe collaborate in the future with other professionals in that field and whatnot. And then if time allows, we're also going to learn more about neuropsychology, what she does and doesn't do, etc.
Definitely, Elsie. Thank you for that intro. We're super excited to have Dr. Meier here. So I'm going to give you a brief bio, and then I'll turn it over to Dr. Meier so she can tell us a little bit more about herself and her journey, okay? So Dr. Adrienne Meier is a licensed psychologist specializing in clinical, forensic psychology, and neuropsychology. She completed her clinical residency in clinical and forensic psychology at New York University's Bellevue Hospital and her postdoctoral fellowship in neuropsychology at City of Hope Medical Center. She has been retained and qualified as an expert on various civil and criminal forensic cases related to mental health issues, neuropsychology, and sexual offending. Dr. Meier also has diverse clinical experiences as she has worked within the Los Angeles County Department of Mental Health, the California Department of State Hospitals, New York Office of Mental Health, and the Veterans Affairs Healthcare System. What a biography, what an introduction. Dr. Meier, thank you so much for joining us here on Let's Psyconnect.
Thanks for having me.
So that was a lot of information packed in, but I just want our listeners just to hear from you a little bit about your journey to how you got where you are right now in your career.
Sure. So when I started graduate school, I already had known that I wanted to work with forensic and correctional populations because I was always drawn to severe mental illness. Because I'm fascinated by the way our brains work and how easily our brains can kind of get off track. How a slight change in neurotransmitters can result in things like psychotic symptoms.
Sure.
So in undergrad, I actually did an internship on a mental health unit at a state prison and just thought it was fascinating how people's mental health symptoms could have impacted their crimes and the things that they did that resulted in them being incarcerated. So that's initially how I got into the field of forensic psychology. So in graduate school, I pursued opportunities to work in correctional and forensic settings so that I could get that practical experience, even though my program is clinical psychology.
Yeah. And I think, as I said, there's so many questions we wanted to ask you about forensic psychology, but let's try to tell our listeners, if you could, what does that mean? If you could describe forensic psychology, what is it?
Forensic psychology is basically just the application of clinical psychology to anything involving the law. So that's an easy way of saying we're using our expertise in clinical psychology, meaning the treatment and assessment of mental and behavioral disorders, to someone's legal situation or their legal case, whether it's a criminal case or a civil lawsuit.
And do you have to go to crime scenes?
No. Not go to any crime scenes, and nor do I ever want to.
And do you have to go to jail, or do you always have to work in a jail setting?
You don't have to always work in a jail setting. So I'm in private practice. So when I'm hired by an attorney, I do have to go to jail if the defendant is in jail, if they're in custody. So I need to evaluate them, and so then I would have to go to jail. But you can also see defendants who are out on bail, or if it's a civil lawsuit, right, the plaintiff is not, there's no legal charges, so they're in the community and they will come to your office.
So you mentioned right there, if you do an evaluation, right, are you doing like a criminal profile?
It's not criminal profiling, so nothing cool like on the TV shows. No FBI criminal profiling. A lot of what I do is focus more on evaluating the person's mental health. symptoms, so their current mental health, and then historical mental health, so whether they were mentally ill at the time of their crime and whether they're currently mentally ill. And applying that, essentially I write a report about that and how that might impact their risk for potential violence or their risk for sexual offending, those sorts of things.
Okay.
Sure, yeah, thank you for asking those questions, LT, because I think it gives a good understanding of what forensic psychology is and what it is not. I think that there's sometimes a lot of confusion because of the word forensic, but it's very important for our listeners to understand, and the general population, anybody who's interested in this field, of what exactly is done within the profession. So Dr. Meier, you talk about how there's a lot of interaction with the law, right? And I'm wondering, because as we are phasing out of our grad school experience, of course, it was a lot of clinical work, a lot of classes. And on top of that, as a forensic psychologist, you have to know and understand a lot about the law. So I'm wondering, your experience, was it very difficult to kind of transition into that aspect of knowledge?
I don't know that I say it's very difficult, it's just a lot more to learn. So I happened to learn it during my program, so that's what I was focused on learning outside of my graduate coursework, was case law and figuring out how the criminal justice system works and how civil proceedings work, because you need to really be familiar with these important case laws that inform how a psychologist approaches cases. So for example, the case law will basically say what needs to be evaluated to meet certain criteria, such as incompetent to stand trial or insanity, not guilty by reason of insanity. And those are things that we have to meet if we're going to do the evaluation. And the same thing for being an expert witness. There's codes of evidence. So there's basically rules about what can be introduced in evidence in any legal proceeding. And we have to be familiar with those in order to allow our testimony to be included.
Okay. And so you mentioned before, so the criminal law, civil law, so the different laws and how they group the cases. Can you tell us a little bit more about how the different components play a role in a case?
So you're asking how the different components of those case laws play a role in my work?
Yes. So like you're sitting with like civil law case versus a criminal law case. Okay, I need to use my head here, and then this is different. So how are they different, and how are they similar?
So criminal law is basically anything involving someone who has criminal charges. So any misdemeanor, any felony, someone who has been formally arraigned by a court and they're charged with something, meaning they're accused of doing something. They haven't been found guilty yet, per se.
Right.
There are times where we do evaluations of people that have already been convicted of their crimes. But in most cases, it's pre-conviction, pre-trial.
So let me ask this. So in what cases, what would you be looking for when you are asked to do an evaluation of an individual who has been convicted?
If they've already been convicted?
Mm-hmm.
So those kinds of evaluations are more like, what is their risk of doing this again? So that essentially the evaluations will just assist the judge in sentencing. So someone is convicted, found guilty or not guilty, before they're actually sentenced and get their formal, you get 2 years, you get 20 years, you get life without parole, whatever it is. Mm-hmm. So in those circumstances, the judge will consider additional information in terms of deciding what's an appropriate sentence. So oftentimes mental health will be something that the judge will consider, as well as the likelihood of them committing a sex crime in the future, if it's a sex crime, or depending on the defendant's age. So in a lot of cases, there's this law called Franklin, this case law, and essentially what that means is that anyone under a certain age that commits a serious crime, their background needs to be taken into account when it comes to sentencing. So their history of trauma, their history of substance abuse, the fact that their brain is still developing when they committed this serious crime, those aspects have to be taken into account to give them a more fair sentence, because a 18-year-old brain is not the same as a 30-year-old brain.
Yeah, and is that nationwide?
Is that, I'm sorry?
That you're talking about the laws, does it apply to the whole country, or is it specific to the state where you see?
This is what's complicated about forensic psychology, is there are some case law and there are some things that apply nationally. Mm-hmm. But there are some that only apply within the state. And so you have to know the difference, and it impacts, you know, a lot of people clinically will try to work in different states and do telehealth, for example. Right now that's really popular, and people are providing telehealth all over the country, even though they live in one specific state. We, as clinical psychologists, we still have to know laws, reporting requirements, and things like that to do clinical psychology in a different state. But the same goes for forensic psychology. We have to know what are the relevant laws and penal codes, because the penal codes also change.
I see. Which again, it's more, there's a lot to learn beyond like what you learn as a clinical psychologist, right? You have to keep up with the laws, the changes, policies, I guess, that can interfere with a case that you're seeing in managing. And so how much do you interact with lawyers, I guess, if at all?
I talk to lawyers and have to work with them pretty frequently. So they're usually the ones who retain me on cases. So they're actually considered my client. When I do a forensic evaluation, the defendant or the plaintiff I'm evaluating, they are not my client. And I make it very clear from the beginning that they are not in charge. Like when you usually see a psychologist, you're kind of in charge of the information. You get to say who the psychologist can talk to or not.
Sure.
That is not the case in forensic work. In forensic work, the attorney or the retaining party is the client, and they are the ones in charge of the information. So especially in either proceeding, civil or criminal, the attorney gets to decide whether or not I'm testifying, or whether or not I write a report, and who they want to give the report to. The defendant doesn't get a copy of the report. They're not, I don't give feedback, I don't give them the report. So it's a much different dynamic that I make sure everyone knows at the outset of the evaluation, that this could help you, it could hurt you, I don't know, but if you agree to participate in this, you know, that's up to you, and then your attorney will figure out how to use this information, hopefully in your best interest, and
hopefully.
That's all I got.
Wow, yeah, so it's very different, I guess, than doing an assessment outside of the forensic psychology world, where you expected sometimes to do feedback or to do like the report and talk to the client. The client is your client. I mean, the person sitting in front of you most likely is your client. So yeah, and you said you also navigated to within a private practice world, right? So sometimes you wear different hats throughout the day, I'm assuming.
Mm-hmm.
Yeah.
So let me also clarify. Can the defendant decline an evaluation? I would presume that if the evaluation is brought upon, it is most likely so it could benefit them. But in the case that they do not want to do it, do they have the ability to decline that?
Yes.
Okay.
The defendant can absolutely decline to participate in the evaluation. It's a little bit more complicated about what happens in that situation, just based on who's hiring you. So psychologists can also be retained by the court or the judge. If you are a court-appointed psychologist to evaluate a defendant, if they refuse, then you can still write a report and come to an opinion without their cooperation, without their consent, just based on medical records and observations, because you saw them, for them to refuse to participate. Yeah, they don't have to participate, and I always tell them they don't have to participate or answer any questions they're not comfortable, because it actually is not assumed that it will help them.
Mm-hmm.
if their specific attorney is hiring a psychologist, then the idea is that it could help them. Whereas the court is appointing a psychologist, the real reason that the psychologist is there is not to help the defendant or not to even help the defendant's case. It's to help the trier of fact or the judge figure out what's going on and come to some sort of conclusion in this case.
Okay. So there's so many variables here, yes. And I don't think Ron and I would knew much about it at all.
I know that's why I was highly looking forward to this conversation, because of course we have a very cursory knowledge of forensic psychology, because you know, going through the program we talk about the different kind of fields you could go into, but it was very superficial in nature. So this is such great information. And now, Dr. Meier, I want to ask a couple questions just about your personal experience. So of course, this is something that you are interested in, and I want to take your point of view or perception. So I think when I hear of somebody taking the stand, especially a witness, I kind of have this idea that they're on the stand and the lawyer's trying to catch them and really questioning them. Have you had that experience? Is that completely different from what's portrayed like on social media or film?
So the question is, are attorneys kind of trying to trick me and out to get me?
Right.
Yeah.
So maybe not out to get you, but when you are called to trial, is there any cross-examination going on?
Oh, absolutely. So if you are ever called to testify, both sides get a chance to ask you questions. So if the prosecutor calls you to testify, then of course the defense attorney is going to cross-examine you. And
okay.
I sort of think of it as more like a game. It is kind of like a game. Because you are also, as a witness, you are also limited to only answer the questions that were asked. So this becomes really challenging if the person who hired you does not ask you the right questions on the stand, because you can't say what you need to say then, and you can't
right.
you can't get the information out that you want. You can't do a monologue. I wish that you could. You cannot.
You can't be like, I have more to say.
Objection. Objection.
Right. And oftentimes they'll ask yes or no questions, because that sort of pins you in a corner, right? Some psychology is very gray. It's not yes or no all the time. It's like, well, it's in the middle, but that's not the answer that they will accept. So oftentimes you'll want to say yes, but, or no, but, and that won't fly in court, because the attorney can just say, non-responsive, Your Honor, strike everything after no from the record. And so then it looks like I just said no. But that's not an accurate answer either, right? That's not what I wanted to say.
Yeah. I mean, I guess you've gotten a little bit used to the whole idea, as you said, like the game scenario, but in the beginning, I guess maybe the first time you went out there, wasn't it very nervous-wracking and just like, ah?
Of course, yes. The first time I went up there was very nerve-wracking. And even as a forensic psychologist, we don't get training in testifying. Like, we work with the populations and we do the evaluations, but especially as a student, you don't testify. So I got to see one of my supervisors testify when I was, I think, in my 3rd or 4th year of my program. But other than that, I'd never even seen a psychologist testify. So I'm just winging it, right? I of course went to some workshops about testimony, but it's not the same as when you're sitting up there.
Of course.
Definitely not. I think Ron and I, we've seen a video that is available on YouTube, unfortunately, because I guess we learned from other people's error too, and how the psychologists get so discredited, and it's sad in so many ways, and it's scary that we don't want to get into it.
Yeah, I'm like, I'm okay. I don't want to take a stand. I'll try not.
What's really fascinating is it's actually not that scary. I mean, after the first time, because first time of anything is a little bit nerve-wracking.
Right.
It's actually I think it's kind of fun, and that's saying something because I really loathe public speaking.
Mm.
I will do anything to avoid having to speak in public. So the reason it feels different is because they're just asking you questions. So
Sure.
you just answer the question. It's not like if you're giving a lecture, it's a monologue and you don't get much feedback from the crowd, from the people listening. So you don't really know when to stop, when to start, when to elaborate, when not to. Whereas in the court, I know what I need to say and I need to answer their questions and somehow get that information into my answers somehow.
Ronnie and I would have to restructure our fears here, and we would definitely call Dr. Meier, like, please help me get ready for
Please. Counsel me.
Well, and you're making a good point, because I think that's what ends up happening for a lot of people is, we forensic psychologists, you meet other people in forensic psychology training along the way, and you consult with each other, right? You talk about there's this case coming up or this is happening. Obviously, you don't give names or details, just like when you consult in clinical psychology. But we talk to each other about what to expect and help each other prep and prepare for things.
It's such a small niche, right? I mean, there aren't that many clinical psychologists that go into forensic psychology, and then it's very important to build that network, of course, and to count on each other. Because if you start talking to maybe Ronnie or I, there's not much that we're going to know, unless you focus on the clinical component of it. But if you start talking about the law and how that pertains, then we'll be lost. So.
Yeah, you're right. It's a very small group, and I think this is the case probably in any specialized area of probably any field, but my experience is psychology. So it is a very small group and a very small world. And so it's very important, even as students, right, that you are not burning any bridges, or you're always professional and on your best behavior, because these things can follow you and come back to bite you. And the same once you're a licensed professional. I mean, the people you encounter, your colleagues, it's a pretty small world, and they all know each other, and so you want to be cordial at all times, even if you might encounter people that drive you mad.
For sure. Yeah, setting the feelings apart, right? Because it's bad. It can be difficult.
And let me add, because you said something, LT, about if our knowledge based on everything related to forensic psychology would be much lower, and I think that's just a good kind of myth to break about psychology as a whole for people who are interested in it or wanting to pursue it, is that there is general psychology, which we all have kind of a general foundation of knowledge, but in terms of different career paths you can take in psychology, there's so many, and just because you have the name psychologist doesn't mean that you know everything about psychology, right? There's specialized fields for a reason. So I just wanted to put that out there for our listeners.
Yeah, and then they might be wondering, like, oh, do I have to go to school for forensic psychology? What would your answer be to that?
My answer would be no. And in fact, there are very few programs in the United States accredited by the American Psychological Association that are forensic psychology PhDs or PsyD programs. Mm-hmm. Because mostly what forensic psychology involves the application of clinical psychology to the law. So first and foremost, we need to be competent clinical psychologists. I mean, that is the foundation. So without that, you cannot be a good forensic psychologist. You might as well just stop trying, because the whole point is we're applying our expertise to assist the judge and the court system in coming to certain decisions. Yeah.
So it sounds like we go to school as a clinical psychologist, right? It's either PsyD program or PhD program. And a lot of schools, I'm assuming here, some schools, I guess I should say, they offer concentration courses. So you can take classes specific to the field of forensic psychology. And then I guess with that, you can figure out more about your interests, right? And then develop that set of expertise and skills. But you have to also continue outside of the academic setting to build on like those skills, right?
Yes, exactly. There are clinical programs that will offer a course, or even some of them have like an emphasis in forensic psychology. And so they'll have a number of courses so that you can gain some competency in that area. But I think the most important experience too is actually getting training in those settings and supervision.
So one question here that I have is pertaining to, you mentioned like I do evaluations. And so there's an overlap here with the clinical psychology, like the general training, also with a little bit of the neuropsych, or a lot about the neuropsych when it comes to understanding those measures and whatnot. So what are some measures, or what it's like to evaluate somebody? What do you look for? If you can tell us a little bit about what the evaluation process is.
Sure. Just like clinical psychology or even neuropsychology, it basically depends on the referral question, right? That is the most important thing to determine what you're going to give. So in forensic psychology, there can be a host of different referral questions. One could just be, you know, the most common thing that happens is an attorney will call and say like, I don't know what's up with this person. They are just not with it. I need to know like what's going on. Can you figure it out? So that's pretty vague.
Yeah.
Usually what they're referring to is mental health symptoms, that they aren't able to work with their attorney very well because of whatever symptoms are going on.
Mm-hmm.
So in those instances, what usually ends up happening is I'll do a clinical interview and then review their medical records. Because the medical records actually are extremely important and helpful because it provides a history across time of a person's symptoms. And for most diagnoses in the DSM, we kind of need to know how long it's been there, right? And someone who is currently psychotic, who I meet with, if they're delusional or they're hearing voices, they're not in a place where they're going to say, yes, this has been happening for at least 2 weeks. This has been happening for at least 5 years. They cannot provide me with that information. And even if they did, I would be skeptical, only because their orientation to reality and time is impaired. So I want to see the records. And so I would say a lot of what forensic psychology ends up being is record review. I mean, I spend a lot of hours each week just reading people's records and trying to find out what symptoms they've had in the past, when they've been hospitalized, what medications they've been on, you know, what's been going on with them. Mm-hmm. And so that actually informs my diagnosis in combination with the clinical interview and the records. If it's just a strict mental health evaluation, that is enough to come to some conclusion about their current mental health and if they meet criteria for a diagnosis. And a question that I often get is, well, why aren't you giving psych tests? Why aren't you giving an MMPI? Or why aren't you giving whatever? A lot of the population that we work with, especially if they're in custody, right? We're talking about lower income, right? Lower SES disenfranchised folks who oftentimes have dropped out of school. They don't have even a high school diploma. And the MMPI requires a certain reading level.
Sure.
You have to be able to read and comprehend things at a certain grade level in order for it to be valid. And it's long. Even the RF is long. And so to sit in a jail cell with another inmate and watch them fill this out, oftentimes what ends up happening is that it's invalid anyway because they didn't understand.
Right.
And even the PAI, or the Personality Assessment Inventory, that one has its a lower reading level that's required. It's like 4th grade reading level, but that's still a pretty high reading level. Even if someone went to 9th, 10th grade, that doesn't mean they're reading at a 10th grade level.
Yeah.
And furthermore, a lot of the inmates that I meet with, English is not their first language. So now I'm giving them a test in English that requires a certain reading level. And it takes, I mean, I've had people take up to 5 hours to do the personality assessment inventory.
Wow.
Which it has 300 and some questions. And just to contrast that, in private practice, when I meet with just folks in the community, yeah, it is taking people 30 minutes. So it should take somewhere between 45 minutes and an hour, around an hour. So it's just really not very efficient use of time, and especially because it's usually invalid. So it doesn't end up being helpful because we just wasted time and got them frustrated filling out this form and didn't get any information out of it.
Wow, yeah. I mean, I was gonna ask you right after if you were asked to use personality tests, because again, of the idea that a personality test is just like, it's gonna tell me everything about it, everything I need to know about this person, because it's a personality test and whatnot. But you address so many of the variables and limitations associated with that, so thank you so much.
Yeah, and I think also that the motivation piece you were talking about, Dr. Meier, that just in my training, I've seen individuals who have come in voluntarily with a presenting problem and still don't necessarily want to sit down for an hour or so to complete an MMPI, and they're coming in under their own volition, right? So I think about an individual who is incarcerated, and maybe their lawyers is pushing them to do this, and they don't necessarily want to. So to ask somebody who has a lot of other barriers and variables going on to sit down and take a assessment like that, it's going to be very difficult, very trying.
Yeah.
Yes, absolutely. And I mean, especially because a lot of the cases that I evaluate, I mean, they are in acute mental illness. So
Right.
they're actively hearing voices, they are delusional. So that is not a time where they're going to sit down and fill out 300 or 400 questions.
Yeah.
It's going to happen. And once I mean, I've worked in a lot of inpatient settings and with people who are psychotic and have various psychotic illnesses like schizophrenia and schizoaffective disorder. Once you've worked with people like that for a long time, it's pretty easy to tell when someone is experiencing psychotic symptoms and to differentiate from when they're faking psychotic symptoms, because they're really hard to fake. I mean, I could fake it. I've seen it a lot. So I could fake it probably for like, I don't know, an hour or two, but to consistently fake it, I can do it. It's too hard to keep up, which is also why their medical records are so important, because if they're hospitalized, people have been watching them 24 hours a day for at least several days. And so they're going to note, like, he only hears voices sometimes, or he doesn't seem to be consistently hearing voices.
Yeah.
Making notes about that.
Yeah. It's a lot of acting.
As part of, I guess, your job, so when you find there's significant difficulties or mental illness and whatnot, do you provide therapy? Then do you know if they get follow-up treatment? You know, like do forensic psychologists also get involved in the therapy aspect of it or no?
So if you are doing an evaluation as a forensic psychologist, you do not provide any treatment. And that's also something that we, or at least I, say at the beginning of my evaluation, is that this is not treatment. No, we will not be doing any treatment today. This is just an evaluation. And I usually tell them I may never see you again unless I have to come to court and testify. So this is a one and done, unless we need to follow up on something in the evaluation. Most likely, this is the only time I'll see you. There are some forensic psychologists who do treatment, but you can't do an assessment and treatment on the same person, because that is a conflict of interest, right? There's the dual roles that you're playing in this person's situation in life, and that's not ethical or appropriate. So I often will tell the attorney, because I give the attorney the results, and I will tell the attorney what they need, right, in terms of treatment. Like, you know, this person is delusional and they need to consult with a psychiatrist and they need to take some medicine. And the attorney, you know, they have resources that they can get for the defendant, or at least give the defendant resources so that they can access the treatment that they need.
Good. I think that, again, it addresses a myth too, associated with forensic psychology.
Yes, it reminded me, questions keep popping up. There's a few more topics that we need to get to, but let me ask this. So I hear, you know, again, going back to just media and lack of understanding, the insanity, or trial, is it trial by insanity?
Not guilty by reason of insanity?
There we go. Yes. So is that commonplace in the field? Is that something that you've come across quite a bit, that defendants actually try to pursue, or is it not as abundant?
No. On TV, it looks like that often are claiming insanity to get out of whatever crime they committed. But in reality, it's really a rare plea. I mean, less than 1% of cases in the nation do defendants even enter the plea. Do they even say, I want to plead not guilty by reason of insanity? Which is a very small number. And then when we look at that number, only a fraction of those people actually are found not guilty by reason of insanity. And it's estimated to be somewhere in like a fourth of that 1% is actually found not guilty by reason of insanity. And I know that on TV or in movies, it kind of gets a bad rap in terms of being like this get out of jail free card or getting out of the consequences of the crime. But all that it really ensures is that instead of going to prison, this person goes to a hospital where they get the treatment that they need for their mental illness, which is what caused them to commit the crime in the first place. And what's fascinating about that is there's no cap on how long you stay at the hospital. If you go to trial and you're found guilty and sentenced, you get a specific number of years that you have to be in prison. That does not happen at the hospital. And so the idea that is picked up by the media is often you can get out faster. But in my experience, it's almost always the opposite. People stay there a lot longer than they would have been in prison for whatever crime they committed, which is why most people don't enter the plea, because unless you're looking at basically life or more than 20 years, it's really not a great route to go, because you will end up at a state hospital for decades.
I think that there would be more, not necessarily freedom, but just more ability to do more activities in a jail setting versus a hospital, right? Where you, on watch constantly.
Yeah, I think it depends on which prison you go to and the situation at the prison.
Yeah.
But I think probably one of the big differences is prison, there's a lot more, we'll say, independence. You might not have freedoms per se, but people aren't watching you. You don't have to go to treatment groups all day. You don't have to, your medications aren't monitored in the same way they are in a hospital. So there might be activities and resources available to you in prison, but no one is like watching you and writing that you're not doing them in the same way they are in a hospital. Most units in the hospital have 40 or 50 patients, and they have a lot of staff, and so they know their patients pretty well, and they know what they're doing, and will monitor and check up on them.
I think we're getting close to the end, but I do have one more question or series of questions to address, because you mentioned again the reading skills are to be low, right? And also that the language, it's not necessarily English. So thinking about diversity here, how do we go to like competence in the field?
Yeah, I think that accessing education and educating oneself is really important. So there are a lot of training on diversity and cultural competence and forensic evaluations specifically. I mean, obviously this applies to the field of clinical psychology more largely, that people need to do the work to develop cultural competency, because not all graduate programs provide enough of it. Of course, they're all required to provide some, but not enough. You have to really go out of your way to get resources and get the information that you need to develop the cultural competency. Because especially when it comes to forensic psychology, neuropsychology, if we're administering psychological tests, we also really need to know the populations the tests were normed on, if that's the same as the population that we're evaluating in the moment. Because if not, then our results aren't necessarily accurate estimates of that person's cognitive functioning or even psychological functioning.
Right.
So these are really important things to be well versed in and to learn about. So you can do that through, there's workshops, there's CDs. You can also get this kind of training through supervision. So most good supervision will include some aspect of cultural competency, talking about cultural differences and how that might have impacted the results, and give you resources and materials so that you can broaden your understanding of different cultural groups and how even mental illness manifests different depending on one's culture. I mean, these are things that are basic to clinical psychology, but it applies to forensic psychology too, because if I'm assessing someone and they're just telling me about a bunch of somatic symptoms, meaning the symptoms they feel in their body, I might say, this person doesn't have a mental illness, they have a physical illness. But that's not true, because in a lot of cultures, they feel they manifest their psychiatric symptoms physically. In that sense, right? So knowing these things and paying attention to them are really important.
Yeah. And one more thing here. So with a forensic psychologist, I guess, work with immigrants in a way of like the immigration law.
Yes, that's a great question. So forensic psychologists do immigration evaluations, and that can look very different. So you can do asylum evaluations, which essentially someone is seeking refuge in the United States because of some sort of torture or some sort of danger in whatever country they are from. And so they're trying to get asylum here for safety purposes. You also can do immigration competency. And so immigration law and immigration proceedings is so different from criminal proceedings. I do immigration competency evaluations, and one of the most fascinating things about immigration proceedings is that the detainee is supposed to represent themselves. Like this whole thing about you have a right to an attorney, and if you cannot afford one, one will be provided to you. That does not apply in immigration proceedings.
Wow.
At all. So you are expected to navigate the immigration process on your own. And when I say that, it's usually in deportation proceedings that you have this competency evaluation, because if you don't understand or you can't act in your best interest, the result is you get deported. You can no longer stay in the United States. So that's a pretty high stake if you don't understand.
Of course.
And in those proceedings, if someone is incompetent in immigration proceedings, all that happens is they're provided an attorney to assist them. Whereas in criminal court, if you're found incompetent to stand trial, you actually go to treatment in a state hospital or a jail setting, and you have to actually be restored to competency, meaning you need to take medicine so that your mental illness and your symptoms aren't impairing your ability to cooperate with your attorney. And you also have to learn about how the court proceedings work. So, you know, a felony is worse than a misdemeanor. What's the role of the judge? What's the role of the two attorneys? The fact that it's adversarial. So you get an education and you have to be housed somewhere else and get treatment. Whereas in immigration proceedings, you just get an attorney to help you figure out which route you can take to defend your case and which paperwork to fill out, those kinds of things. But I will add that in immigration proceedings, the judge is much more collaborative than they are in criminal court. Like the judge kind of will tell you what you qualify for and is a little more helpful than in criminal proceedings. The judge would never do that. That is not the judge's role. The judge is not going to tell you what you should consider in terms of your legal strategy.
Right.
Yeah, I mean, it's a whole different world, I guess, you know, that if you're not involved in it, it's very unlikely that we as psychologists will know much about it, let alone the general population. We're just glad that people out there like you that have facilitated this work, you know, and have helped out there, because it is much needed for sure.
Well, it's certainly rewarding too. I mean, it's never a dull moment. And I mean, even just talking about forensic psychology, you could see how there's so many different aspects, even under this one umbrella, that if, you know, you were saying earlier, Ronnie, that, you know, if someone is a psychologist, it doesn't mean you know all these areas. And the same goes with forensic psychology.
Right.
Just because someone's a forensic psychologist doesn't mean that they do all of the aspects of forensic psychology. For example, I don't do any, I really don't do much family law, anything involving family law. I don't do custody evaluations. I don't do any of that. So if someone had questions about that, I automatically just send them somewhere else, because I don't know much about it. I don't care to know anything about it, about specifically custody evaluations. Mm-hmm. So you can go to someone who does that.
As you're saying, there's a lot more under that umbrella of forensic psychology. Yes.
Yeah.
It's been great. Go ahead, Ronnie. You have to.
I just wanted to say, but what you do have knowledge on is a lot of other great different, I guess, avenues within forensic psychology. Thank you so much for sharing your experience. Criminal law, we talked about some civil law, immigration law, some neuropsychology was involved. I couldn't think of a better guest. So thank you so much, Dr. Meier. I know that we enjoyed this conversation greatly. We would love for you to come back and continue this conversation as well. Some more topics. There's so much involved, right?
Yeah, well, I'd love to, and this was great. Thanks for having me. It was fun to chat about forensic psychology.
Thank you so much. How would our viewers or listeners find you if they want to follow you or get in touch with you?
So I have a website, and that's just drmeier.com. And then also I'm on Instagram and Twitter, and my handle is Dr. Adrienne Meier. So,
okay.
Yeah.
Sounds good. We'll be tagging her on our episode description in our podcast, as well as on our Instagram, so that you can definitely just click on the link and get connected with her. And stay Psyconnect with us in between episodes. We're on Instagram, Facebook, and Twitter. Let's Psyconnect, all one word, lowercase. And if you want to reach out to us, send us an email, discussion@letspsyconnect.com. And remember, let's Psyconnect.